Hi, everyone. My name is Heather Augustyniak. I am proud to introduce the Life After Cancer series again. Today, we have a very special guest. We have the Chief of Psychology here at Baptist Medical Center and Baptist MD Anderson Cancer Center, Dr. George Royal. He will be talking about moving forward after cancer treatment. And with great pleasure, I will let him take over.
Okay, thank you, Heather. And I'll do that, and I'll do that, and there we go. Well, thank you for coming today and listening to my presentation. As Heather mentioned, I'm the Chief of Psychology here at Baptist MD Anderson Cancer Center. Basically, I've spent the last 30 years of my career working with cancer patients and their families, primarily here at the Baptist Cancer Center with adults, but have also worked with children in the past. And one of the most important things that people talk to me about is how do I move forward once I've finished my cancer treatment? So today, I want to review briefly some objectives of what we're going to cover. And what my goals are. First and foremost, my goal is to help you and your family begin the cancer survivorship journey and move forward. I also want to review some of the basic concepts regarding the adjustment to the diagnosis and treatment and the recovery from cancer. I want to help you and your family identify some of the common concerns after cancer treatment and to learn to recognize some of the signs and symptoms of anxiety and depression. And of course, being a psychologist, I would like you to learn how and when to obtain psychological support. So whenever I talk with patients and families, I like to review some basic concepts because I think a lot of times there are some misperceptions about what the cancer experience is like. So first, I say it is normal for cancer patients to look back. The diagnosis and treatment of cancer is one of the most stressful events that a patient and his or her family will ever experience. So it's common for you and your family to look back and think about how you might have felt at the time of diagnosis, waiting to start treatment, how you felt during the treatment, coping with some of the side effects that you may have had. And then most importantly for survivorship, it's when you finish your treatment, you start thinking about the future and what is going to be my new normal. So looking back, patients sometimes experience distress only after they complete treatment. And so I want to present these things to you and your family so you understand that these things may occur and show you some ways to deal with them. So after treatment finishes, I have patients who come to me and say, I can't sleep. I'm having flashbacks and nightmares about my experience. I feel depressed. I avoid things that remind me of the cancer. I lack joy. But I point out to them, there is hope. By getting help, there is hope to survive and move forward. These problems clearly, in my opinion and my experience, are temporary. Things can and will get better with time and with understanding, and by getting the support that you need through the process of what I say is taking control of your life. One of the things in this slide that one of the patients actually gave me this little picture, it says, don't look back, you're not going that way. So I hope to help you move forward today. Second basic concept is that cancer does not affect individuals. It affects families, friends, neighbors, church members, co-workers, everybody around you. And it's important to realize these same people that are affected by your cancer experience are going to be the ones that are going to help you move forward, along with your medical team. Another common misperception that people sometimes have is that cancer only affects you physically, but in reality, it affects many areas of your life, both physically, emotionally, spiritually, financially, your ability to eat, your ability to sleep, leisure, quality of life, and many other things. But you have the ability to take control in all of these areas, and I hope to help you do that tonight. One of the things I talk with all my patients about is lack of control. I really believe in working with cancer patients that the lack of control leads to feelings of stress, anxiety, depression, fear, feelings of helplessness and hopelessness, and most importantly, a poor quality of life. So if loss of control leads to all these problems, then the opposite is also true. Learning what you can control and how to take control of your life will definitely help improve your quality of life. Survivors differ in their physical and emotional adjustment to cancer and cancer treatment. I put this in here because I want people to realize there's no right way or wrong way to feel. Some people simply sail through the diagnosis of treatment. Other people have physical concerns, and then even others have emotional problems after they finish treatment. Your journey is unique to you and your family. So, the secret to successful survivorship. Well, everybody wants to know that, and hopefully, I can give you some insights. I think it's important for you and your family to understand your diagnosis and the treatment that you've been through. You need to understand post treatment physical and emotional issues. You need to develop a post treatment plan. You need to get support, and you need to learn how to communicate. Communication is one of the keys to survivorship. So, the survivorship journey. What's the plan? Well, the first thing I tell people is you need to ask your doctor for a treatment summary. It's important that you know what your cancer diagnosis was, what type of cancer, the location, size, the date you were diagnosed. Also, you need to know what medical treatments you received. Did I have surgery? Did I get chemotherapy, radiation, or all of the above? The reason it's important to have these pieces of information is it helps you talk with other people and explain to them what you've been through and what you're going through. And specifically, I mean when you talk with your family doctor or a mental health professional or even friends, they need to know what your experience has been in terms of the treatment itself. So, what's the plan? Well, as Heather will tell you, you need a survivorship care plan. And some of the main components of this include a treatment summary, as I mentioned. You also need to know what follow-up appointments am I going to have? Who am I going to see? How often am I going to see them? When will I see them? You also need to know how we're going to monitor you after treatment is completed. What type of tests am I going to have? When will I have them? How often? And I also encourage patients to talk with their medical team about potential signs and symptoms of possible recurrence, because that's one of the main things people worry about. So asking what signs might indicate recurrence is important, but equally important is what are not signs of cancer recurrence. That way you're prepared to deal with any problems that might come up. In addition, your survivorship care plan should include some short and long-term side effects of cancer and cancer treatment so you understand what these are. And more importantly, how do I manage these things or minimize and cope with these issues? I want you to learn preventive measures that you can take to stay healthy because you've been through a difficult journey. Now we want you to return to a state of health. And I suggest to people that nutrition, exercise, eliminating alcohol and tobacco, and reducing stress in your life will improve your health, but also your quality of life. So we need to look for resources and strategies to help you manage both the physical and mental health issues. So I think even though I'm the psychologist, I talk with my patients about the physical issues that can be related to cancer and cancer treatment. So some of the things that folks have talked to me about over the last 30 years include, and number one is fatigue and weakness. Many of my patients finish treatment and hope and expect to feel better fairly quickly, but it does take time to get your energy back, to feel healthier, and to feel stronger. Other things that folks have reported to me include pain and neuropathy. That's the numbness and tingling you may have in your hands and feet. Lymphedema, which is the swelling in your arms or legs. Sometimes there are hormonal changes caused by the cancer or the treatments, such as hot flashes, night sweats. Bone and joint problems, muscle weakness, memory loss, or trouble concentrating. These are some of the early and common physical things that people report. In addition, they tell me they have changes in sexual function and fertility. They have difficulty fighting infection due to their blood counts being low. They may have anemia or a bruising. Skin and nail changes can occur. Changes in your physical appearance, such as hair loss, surgical scars, eating problems, which can lead to weight gain or weight loss, both of which people talk to me about. and GI issues such as constipation and diarrhea. So, physical issues after cancer, there are a number of them, but remember, not all of these problems are going to occur for you or your family. The key is to be aware of them, and more importantly, is to speak with your medical team about what can I do to deal with these physical issues. Okay, so you have a psychologist talking to you today, and I'm interested in particular in the psychological issues after cancer. So, what I tell people is the completion of treatment is one of the most difficult and stressful times, and it is, believe it or not, the majority of patients who I see have completed treatment. They are cancer survivors who are now experiencing stress, anxiety, and depression because they're done with treatment. And when I talk to people outside the cancer arena, they don't understand that. They think, oh my gosh, they're finished with their treatment. They should be happy. They should be excited. They should be relieved. Well, oftentimes patients during their treatment are so focused on the physical challenges of the cancer treatment that they ignore or are not aware of their emotional distress that they're experiencing during the process. So I talk about 6 common feelings or emotions that people experience, and there are no right or wrong ways to feel after the cancer experience or the cancer treatment is completed. This is different for every individual and his or her family. The key is understanding. Understanding leads to coping. And I like this little quote here. It says, the first step towards getting somewhere is to decide that you are not going to stay where you are. So if you're depressed and anxious right now, we need to help you move forward, okay, to be a survivor. All right. One of the most common feelings that cancer patients talk to me about is uncertainty. Accepting cancer means accepting uncertainty in your life. However, cancer, like other medical problems like diabetes and heart disease, is a chronic illness, and I want you to start thinking about it as something that you can learn to live with and that we will help you with. A common struggle during this time is trying to control the uncertainty and the unknown, and that tends to lead to those feelings of helplessness. It is clearly very important for you and your family to try and attempt to live in the present than focusing on what might happen. And that's a big request and hard to do, but it's something that I think we should set as a goal for all of our survivors. Buddha said many, many, many years ago, the secret of health for both mind and body is not to mourn for the past, worry about the future, or anticipate troubles, but to live in the present moment wisely and earnestly. I simply say there is hope. There is hope for you and your family that you will be able to move forward. A second common emotion is guilt. Sometimes people blame themselves for their illness. You've finished your treatment, you have time to sit down and reflect back, and you start feeling guilty that you may have done something that caused your cancer. The truth is, more often than not, we really don't know what the cause of an individual's cancer is. And other people sometimes feel guilty that they've been a burden to their family. That's probably one of the most difficult things people talk to me about. And people worry about passing genetic factors on to their children. But you know and I know that guilt leads to problems like insomnia, anxiety, depression, high blood pressure, digestive issues. It doesn't help. So what I say to people is you have to forgive yourself. You are not to blame for your cancer. Move forward. Love yourself. Third common emotion that I see after cancer treatment is anger. What I have found is that anger often reflects feelings of frustration, helplessness, hopelessness, and loss of control. And I believe that anger is sometimes an individual's outward expression of the fear they have within. As we all know, anger can be misdirected. It can be directed at the people we love and care most about. But it really is a terrible burden that is self-destructive. So what do I tell people? We have to learn how to let go. We have to move forward. And when we let go of anger, we do start to heal. And so do our friends and family. Fear. Fear is a natural part of life. It's okay to be afraid. One thing I've learned is that the more that a person knows about their cancer, about life after cancer, the less they have to fear. Sometimes just acknowledging the fear that you have or sharing it with someone else makes it more manageable. Even if you can't do anything about it or they can't do anything about it, I encourage your loved ones, if they're listening to this talk as well, is just listen. Understand what your loved one's afraid of. In order to overcome fear, you have to realize that you should not suffer in silence and that you are not alone. There are a number of people there who will help you. You just have to be willing to reach out and accept it. Depression, one of the most common things referred to me as a psychologist, and things like fear and anger and helplessness and hopelessness lead to depression. And we've all been depressed to some extent. Sadness and short-term depression is normal. However, when long-term depression or depression that interferes with normal daily functioning or treatment compliance becomes a problem, that is a significant concern that we need to get some help for. So I get asked almost every day by new patients, what is depression versus anxiety? I don't know if I'm anxious or I'm depressed. So I'm going to tell you about depression and then I'll tell you about anxiety. Some of the more common symptoms of depression are things like tearfulness, sadness, hopelessness, withdrawal, refusal to participate in activities, change in appetite and weight, fatigue, restlessness, trouble concentrating. It can include suicidal ideation, poor self-esteem. All of these things may occur when an individual is depressed. Any one or more than a couple of these things are not definite indicators that a person is clinically depressed, other than the suicidal ideation, in which case help is definitely needed. And when it comes to treatment of depression, these are some of the things I recommend. Obviously, I'm a psychologist, so I will recommend individual supportive therapy. But we also have family therapy. There are groups, there's support groups, group therapy. In order to work with depression, you also want people to engage in social and leisure activities. Physical activity and exercise is approved by your doctor. Proper rest and nutrition, and there are medications. I am a clinical psychologist. I am not a psychiatrist. So psychologists, we do not prescribe medications, but we work with our colleagues who are physicians and recommend medication at times. Anxiety. What is anxiety? Anxiety is a state of uneasiness and distress about future uncertainties. Mild to moderate anxiety that is short-term is common and not pathological. Long-term or intense anxiety that interferes with normal daily functioning and/or treatment compliance is a significant concern. I often mention to people that I am referred patients who are depressed and anxious. It is those who are anxious that are most eager to be seen because anxiety is such a negative feeling and really distressing. So how do you know if you're anxious? Well, besides being nervous, things like heart pounding or racing, feeling of choking, dizziness, fear of the worst, you can't relax, you may be sweating, fear of dying, feeling terrified, problems with your memory, appetite changes, trembling, and obsessive thinking about panic and panic attacks. Those are all symptoms of anxiety. So what are some common anxiety-producing events? And these are things that patients have told me. Probably number one at the top of the list is once I completed treatment, every ache, pain, and physical symptom I had made me think, Dr. Royal, that I had a recurrence of cancer. That is clearly very stressful. The second most common thing people talk to me about is waiting for medical appointments and tests and waiting for results of tests. Because once you're done with treatment, you're hoping that all your results will be negative and everything will be fine. Post-treatment side effects can be reminders of cancer. That's things like scars, pain, changes in your physical appearance. Obviously, hearing about other people who've been diagnosed with cancer or hearing about people who die from cancer is clearly anxiety-producing. As we've mentioned, completion of treatment is a very anxiety-producing event. It's a time when many people feel like their support is gone and they worry about the future and fear of cancer recurrence and emotional triggers. A lot of people talk to me about seeing billboards about cancer or TV shows about cancer. Years down the road, they'll say, gosh, every time Breast Cancer Awareness Month comes up, I start to get nervous again because I had breast cancer 10 years ago. Those are fairly common anxiety producing events. So the big question for me is, hey, Dr. Royal, okay, all these emotions are common. How do I cope with these things? There's got to be an answer. And yes, there are some things that you can do and your family can do to help you cope with all of these negative emotions that you see right there. I've been here, like I said, for almost 30 years, and I've come up with my tips for coping. And these are things I've learned through clinical practice, through research and study, but most importantly, by talking to my patients. They've helped me come up with this list of things that I want to suggest to you will help you cope with survivorship. Okay, number one on my list for coping with emotional distress and survivorship, depression, and anxiety is proper nutrition. It is clearly important that your body needs nutrition in order to heal. You tend to feel better when you eat appropriately. You have more energy. Nutrition also strengthens your immune system. So when you're thinking about, my gosh, what happens if the cancer comes back? I'm not doing any treatment. Remind yourself that, hey, I'm protecting myself through proper nutrition. Number two, getting enough rest and sleep. When we are not rested, we don't feel well physically or emotionally. When you sleep, your body is healing, you are recovering, your immune system is strengthening. So rest is important. If you're having problems in that area, you need to talk with me or your doctor. Number three, physical activity and exercise as approved by your doctor. There's a lot of research out now that suggests that physical activity and exercise is one of the key variables in helping reduce the reoccurrence of cancer across a number of different cancers, across men and women, various ages. So I suggest to you that you speak with your doctors and see what's appropriate and that you start exercising. One of the benefits of exercise is not just losing weight, but it also releases endorphins. Endorphins are the natural feel-good hormones we all have within our bodies. So when we are exercising, we are producing endorphins and actually giving ourselves an antidepressant. The other thing that exercise does is it stimulates the immune system. It helps your body protect you. So nutrition, sleep, and exercise, those things are going to help you going forward in survivorship. Number four, as far as tips for coping, is work, leisure, and social activities to keep you active and so that you don't think about or ruminate about the cancer. When you're busy doing things you enjoy, you are not thinking about cancer. So come up with a list of things that would be fun for you and your family, but also engage in work activities. These are distractions. When you're distracted from thinking about the cancer, you're not going to be as distressed or anxious. Number five, information. Please do not hesitate to ask questions, particularly in survivorship. Many people I talk to say, well, I don't really meet with my physician or my medical team anymore. We now have the benefit of Heather and a survivorship program here where you can ask questions and get information. Number six, that's my arena. It's psychological counseling. I say to people that psychological counseling can help you cope with stress, depression, panic, anxiety, and a number of other things. Number seven, there are medications that you or your family member can take to help control anxiety and depression. Speak with your medical team. Number eight, I want you to make plans and set some goals for yourself. Many times I've had patients say to me, I've stopped making plans for the future because I don't know what's going to happen to me. Well, that only creates more stress and anxiety. So make some plans, short-term plans. Last week I was asking people, what are your holiday plans? Come up with things that you enjoy and do those things. Number nine, I encourage you and your family to have faith. be optimistic, and use positive affirmations. If you Google positive affirmations, this is what you're going to find on the internet. These are things that you can say to yourself that are positively oriented, that are going to be emotionally uplifting. A lot of patients talk to me about their quote, stinking thinking, which is, I'll never get better. My hair will never come back. What if the cancer returns? I'm hopeless. No, what we want you to do is focus on positives and say things like, I'm doing my best. I'm proud of myself. I am not alone. I am in control. I am loved. I have strength. I am beautiful. Those are all positive affirmations that it takes a while to get used to it, but you will feel better if you use them. Number 10, healthy behaviors. Do not use tobacco products. I'm sorry, vaping, I include that in there. Tobacco products, vaping, those are things that we know are linked to cancer recurrence. And so are things like alcohol and drug abuse. These are unhealthy coping behaviors. Instead, do the healthy things. Eat right, get enough sleep, exercise, have fun. Number 11, this one's very important. Express concerns. I have to tell people all the time, guess what? Nobody can read your mind. Not your doctor, not your nurse, not your spouse, not your kids. If you have a problem or concern, you need to speak up. If you want somebody to help you or do something with you or for you, you need to tell them. Do not believe that they can read your mind, so speak up. Number 12, I encourage people to keep a journal. If you do journal or you blog or even emailing and talking to people, I suggest that you include something positive every day. Even if you're having a really bad day, take the time to look around and find something positive and include it in your comments. Number 13, identify and reduce stress. Sounds pretty straightforward, but people don't think about that. Sometimes when I'm talking to folks in my sessions here at Baptist MD Anderson, and we're talking about their anxiety, and I get into the nitty gritty, and they're worried not about the cancer today or recurrence, they're worried about the fact that they can't get their house cleaned. They're worried about their garage is a mess. And so I say to people, okay, identify what it is you're worried about and come up with a plan to resolve that. Also, identify ways that you can do things to feel better, such as listen to music, get some fresh air, read a book, go to a movie, go to a play, anything. Again, Google this and you'll find lots of ways to relieve stress. Always report medical problems. That's a no-brainer. If you have a physical concern, call your medical team. Let them know. Focus on strengths and positives. Practice gratitude. Yes, you and your family have been through an incredibly stressful journey, and that is the journey of cancer. But there are a lot of good things. There are many strengths and positives that you have and they have, and we need to learn to be more grateful. That will help you feel better emotionally. Number 16, give and accept love and support. Many folks I talk to say, oh, I'm so bad about accepting help. I don't want people to help me. Well, when we let other people help us, we feel better and they feel better. It's like a win-win situation. So don't be afraid to give and accept love and support. 17, tell other people your needs and feelings. People are going to make assumptions. I still love the case of the lady that told me when she was going through her breast cancer treatment that her neighbors had all decided to cook her meals. And at the end of about 3 weeks, she had about 12 frozen lasagnas in her refrigerator or in her freezer. And she didn't know how to tell them that she appreciated it, but that's not what she needed. What she needed was somebody to walk her dog. I said, there you go. You need to just speak up and tell people what your needs are. Number 18, you're a survivor, but be realistic of yourself and of other people in your family. It's a difficult journey that you've been on. It hasn't ended. It continues. And you have to be realistic. You're not going to have your energy back immediately. It takes time. Number 19, I encourage people to meditate, to pray, to learn how to relax and learn some breathing techniques. And then finally, focus on living one day at a time. We need to be present focused in order not to feel anxious. If we worry about what might happen constantly, we can't control what's going to happen 5 years down the road. Stay present focused, be positive, be realistic, and live one day at a time. Okay, so you're probably wondering, well, why should I talk with a psychologist? I mean, what are the psychologist's goals? How do I even make an appointment? And what should I expect if I do talk to a psychologist after I've completed my cancer care? All right. So, what are the goals? And these are some things that I kind of jotted down as general ideas that I wanted people to understand. Okay. So, number one is my goal for you and your family is to improve your quality of life. That is a very basic thing. And sometimes when I'm talking with folks, we talk about cancer treatment, medical treatment, extending life. And that, wow, that's great. That's what we want to do. But the other dimension is how well we live. And so that's where I think I come into play, is helping people improve their quality of life. Next, seeing a psychologist can help prevent emotional or psychological problems. Some people are a little bit depressed or a little bit anxious, and sometimes talking with me, we can work through those things so they don't become bigger problems in the future. I often provide hope, reassurance, and encouragement, as well as support to people. That's to give you a positive outlook on your future. One of the other things I talk with families about is normalizing responses to the illness in terms of the emotional, psychological, social, and behavioral and physical effects. That's what we're doing today. We're talking about what are some of the normal things that a survivor experiences during the treatment and afterwards. My job is to provide you and your family with support, to help you learn coping strategies, to educate you and your family how to deal with these problems that you may face once you finish treatment. I work with people on problem solving. And I have to say this, when I meet with people, the cancer is never, I repeat, never the only issue. There's always other issues. Family issues, education issues, work issues, financial issues. So my patients and I sit down and we do a lot of problem solving. Here's the problem, Dr. Royal. Let's work through it together. Let's come up with some goals and a solution. One of the things I do during and after treatment is answer questions. I am not a medical doctor, but I've been doing this a long time, and I find that I can oftentimes put things in relatively simplistic terms because I've learned from my patients and they learn from me. So we can talk about those things. I am trying to help you use your normal adaptive defenses and bolster them, make them stronger. You're a strong person. You're a survivor. Let me help you with that. I also clarify information and correct misunderstandings, both during and after treatment. People have sometimes misperceptions about what life is going to be like during and after the cancer experience, and I talk to them about that. Sometimes I send them back to their oncologist to talk about some of their concerns and questions. Other times I just provide them with information based on my experiences. Another thing I do, I identify maladaptive coping mechanisms. I talk about my 20 tips for coping. These are 20 things you can do to reduce stress, depression, and anxiety. But I also mentioned there's some maladaptive things that people do, and that includes smoking, drug use, alcohol use. Those things do not help you. And my job is to help you develop alternative coping strategies. The other thing, again, as I mentioned, I help people explore other areas of stress, the family role, lifestyle changes, and I encourage family members to share their concerns and to support one another through this experience. I also am an advocate, and so is our survivorship coordinator. We advocate for our patients with the medical team, so come to us if you have questions or concerns. We also help facilitate communication with your medical team, which sometimes can be difficult. And obviously, one of my main roles is to help people transition from being a cancer patient to being a cancer survivor. So, you may be wondering, well, how do I make an appointment? I think the first and easiest thing I say is, well, gee, talk with your survivorship coordinator or talk with your physician, nurse, or nurse navigator, or one of the physician assistants. They can make a direct referral to me or my partner, Dr. Blanche Williams. There's two of us here at MD Anderson. What they do is they put through an order and it comes to our office. We review it. We give it to our coordinator who schedules a new patient appointment for you. I also say you can call me directly. That is my direct phone number, 904-202-7334. Sometimes it's hard to get through to other people, our doctors or Baptist Behavioral Health, so call me and I'll get you an appointment. We do work for Baptist Behavioral Health in addition to Baptist MD Anderson, so you can also call their main number at 904-376-3800. If you go that route, press 1 for the new patient coordinator, and be sure to tell them that you're looking to make an appointment with a Baptist MD Anderson psychologist. So what should you expect when you come to see me? And the very first thing I do when people walk into my office is I try and put them at ease. I try and explain to them that the reason we're getting together is really to get to know each other. This involves me understanding what they've gone through in terms of their medical history, their social history, and lets me understand what your individual concerns are, or maybe those of your family. I think that first appointment allows us to decide together whether or not you need or want psychological support services. The truth is, many times I see people just one time. We meet, we go over concerns, we make sure the patient is headed in the right direction, and we say, call me if you need me. The other times when I meet with people, we say, well, there's a few issues here that might be helpful for us to talk about, so let's get together a few times. In that initial meeting, I'm trying to work with you in terms of developing a treatment plan to assist not only you, but also your family in moving forward as survivors. And again, as I said earlier, this initial consultation with me or Dr. Williams allows us the opportunity to give you and your family support, but also reassurance, encouragement, and hope. So that's kind of a brief overview of my views on the survivorship experience and how to move forward. Like I said, each of you is on a unique journey. I would encourage you to reach out to me or to our survivorship coordinator or any of your treatment team if you have any problems. We're happy to work with you. I appreciate your time in listening to this, and if anybody has any questions, I'd be happy to answer them.
Dr. Royal, it's Heather. A few questions. One is, how do I know when I'm ready to give back as a mentor?
That is a great question. And I can remember literally in my very first year here being asked that exact question. When am I ready to help other people who've gone through the cancer experience? The first thing I tell folks is I want them to be relatively stable and have healed both physically and emotionally from the treatment that they've gone through. They need to do some self-checking to make sure they're okay, that talking with other cancer patients doesn't trigger anxiety for them. But I've had beautiful experiences with a number of people who have later reached out to others and been very supportive. So you have to do a little self-monitoring to make sure you're okay first, and then you can be of support to other people with cancer.
The other one has to do with relationships and reconnecting after cancer, specifically with marriage.
Okay. The cancer experience is stressful. It does put strain on the marriage at times. At times, it brings people closer together. At other times, it pushes people apart because the partner doesn't know how to support their loved one going through the cancer experience. Don't ignore these problems. If there is a concern about the marriage, I would encourage people to reach out and seek counseling, talk to a neutral party, a therapist. and address these concerns. I said in my talk, nobody can read your mind. If we were doing the "I've just been diagnosed" talk tonight, I would say, for heaven's sakes, from the get-go, tell your partner what your needs are. If you want him or her to go with you to every single chemotherapy treatment, tell them. I think communication, Heather, is the key. I think when couples communicate openly and honestly, they can move forward together, but it's a rough journey. The other thing I will say is that sometimes the partner has more emotional difficulty going through this process because they feel even more helpless. They can't treat the cancer, and they love their partner so much, and it's so painful to see them going through this that they develop depression and anxiety. So support for the partner can also be very helpful in the marriage itself.
Lastly, related to parenting, how may a cancer survivor realize if their child may benefit from therapy?
Okay, that's a great question. That's a whole nother hour talk. Um, I actually am a child psychologist by training and am very interested in children. Um, you know, Children are going through the experience just like parents are. And so one of the first things I tell parents is it's important to be open and honest with your children about what you're going through. I think you should provide information that is age appropriate and positive and optimistic. Okay. So answering questions is very important for children. They are going to have some questions, but as far as answering what you asked, I encourage patients to kind of check in with their kids. How are they doing in school? Are they still doing their social and leisure activities? Do they have friends? Are they eating appropriately? Have you noticed some withdrawal? Younger kids, is there more clinging behavior? Is there acting out? My experience here at the Cancer Center has been sometimes parents are very worried and they'll bring their kids in and the kids will talk and the kids will answer or ask questions and I'll answer them. And then the kids are like, okay, everything's fine. But some of the more significant signs are, particularly in older kids, are any kind of suicidal thoughts or statements, self-injurious behaviors. If older kids are drinking or doing drugs, not going to class, not doing your homework, not coming home. Those are signs that the child or the children are struggling and they probably do need some psychological support.
Well, thank you so much for this presentation. I think it could benefit every single cancer survivor at Baptist MD Anderson. I hope they get the opportunity to review this video. Um, all the
Right.
content was great, and just thank you. I can't thank you enough.
Well, thank you, Heather. I appreciate the opportunity to talk because I do like trying to help people.
Awesome. Well, everyone, next month we'll have another presentation, so stay tuned. Take care. Bye.
Thank you. Bye-bye.